Hello, everybody. Okay, great. I will start now. Thank you so much for joining me. My name is Laura Gómez, and I'm the CEO and co-founder of Profunda Health, which we'll be covering today. I am the founder and sit on the board of a nonprofit called Proyecto Sol, which is focused on advancing access and safe spaces for Latina mental health here. And I've been doing that for about 5 years and Profunda for about 2 years. I will share now and I will also leave some time at the end for questions, but feel free to send to put questions in the chat or if you have any other information. So thank you so much for being here. Really appreciate it. And I will start sharing my screen so you have access to my whole screen. Okay, and let me know if I see that you do have access to my screen. Profunda Health, this is specifically done, this presentation is done for Connected by Care. Thank you so much for having me and integrating behavioral health into care. I'll also do a quick demo and I'll have leave the last 10 minutes to actually have everybody talk about any thoughts that you had here and who I am and what we're building. So let's get started. I also did a lot of prompts to try to figure out how can we actually reflect how we carry what we have our collective histories. So for example, here, this image is of a woman and that younger child, and it is not only carried through the memories or through behavioral and mental health, but actually through the biological imprints, which we'll be focusing on. So here's the team. We are all grounded in lived experience and research, and we also have a lot of professional background. For me, I have an MPH that I obtained during the pandemic and a master's in sociology, focusing on the social construction of childhood. And after my master's, I wanted to work for UNICEF. Unfortunately, or fortunately, I live here in the Bay Area. I grew up as a child of immigrants and immigrant myself in the San Francisco Bay Area, where I worked in tech. And this is my second time being an AI founder. My first startup was around predictive analytics for the workforce, and that focused on diversity and inclusion. We also have my co-founder and CTO, who is a immigrant herself and has deep experience in AI medicine, and our clinical director, who's a board-certified psychiatrist, an MD, MBA, and who's a former National Institute of Mental Health clinical fellowship focused on computational modeling. So this is the team. This is who we are. We're focused, and we are excited to be here. And our mission, it was to bring technology tools to all types of populations, especially those in the safety net and those are have been historically underserved. And in today's session, there's a lot of things going on here. So, and I'm not able to really see comments, but once I stop the presentation, we'll be able to see that. Um, our vision here is to integrate behavioral health into every point of care, and it also known as collaborative or integrative care, which drives measurable improvements in outcomes, access, and cost effectiveness. Um, there's a reduction. So, for example, in general, a lot of this is all evidence based. If you actually integrate either a little bit or a lot of collaborative or integrative care into primary care or any types of models, it actually lowers the total healthcare spending by up to 40%. Um, there's an improvement in treatment adherence by 68%, and one in five adults in the United States right now are experiencing a mental health condition. But routine screening, even as short as 1 or 2 questions, and this is where I really want to emphasize that this session is definitely about what you can do, and it's not about the minimal, but what it can actually evidence-based impact can be done to dramatically increase the care of not only adults with mental health, but also reduction in total care costs, even from chronic diseases management. When we think about screeners, we know that it takes time and that it might take time away, but we also understand that even big impact, and screeners all have a shorter version. So brief tools like what we would talk today is adverse childhood experiences, ACEs, PHQ-2, and GOT2, which are just short screeners around anxiety and depression, can actually uncover trauma, stress, and anxiety that can offer underlying alongside other comorbidities or physical conditions such as diabetes, pain, and heart disease. Integrated models do work. They work in all types of settings, and it actually improved depression, anxiety remissions for up to 60% compared to 30% with standard care. And the reason we're all here is whole person care does drive equity. Integration reduces disparities in access to behavioral health, particularly for women, low income populations, and communities of color. When someone understands what whole person care, and even understanding that they're not there just for a physical health condition, but also all the things that are associated with their wellness, including their mental and behavioral health, people think that this is like someone actually reading the book with them and not just one page of what their symptoms are. I'm going to stop really quick just because I actually want to know if anyone's here. Okay, we're all here. Go back if there's any questions. I will speak on what Profunda is, and this is basic on adverse childhood experiences and early life adversity. ACEs is something that I myself from lived experience have had, but didn't know there was actually a term for it. And I didn't know how it was impacting my health and those of my community and those of my family. ACEs actually cost the US healthcare system up to $14 trillion annually, with direct medical cost of and lifetime cost per affected adult. It actually reduces the lifespan by 20 years, not just through the behavioral mechanisms that someone might take in order to cope with what happened in their early childhood or their childhood as far as trauma, but it does reduce because the biological imprint of the dysregulation internally. And there's a higher healthcare spending of those people that live with 4 or more ACEs. There's 10 ACEs, and we'll go into it right now. The ACEs study was a landmark study in the late 1990s, and it was led by the CDC and Kaiser, that said that these 3 types of ACEs actually are biological grounded into the adult health outcomes, everything ranging from diabetes to kidney disease to strokes. So these are the 3 categories: neglect, abuse, and household challenges. Since then, we know that extended ACEs around community and or other types of sort of ACEs are taking place now. So everything from bullying to community violence are considered ACEs. But for the study itself, they focused on what was happening within the household. And so the neglect, abuse, and household challenges range from incarceration to interpersonal violence between the caregivers to a permanent loss of a parent. Back then, they would say divorce. We do believe that in times now, there's people that co-parent healthy. So it is a permanent loss of a parent through either a divorce or a separation, as well as a caregiver's mental illness and abuse are into the three uh, parts, which are physical, emotional, and sexual, and neglect, emotional and physical. So these have been tied to specific types of diseases, and we'll go into it when we talk about how can we understand people's lived experience through here, not just through saying we're trauma informed or trauma focused, but just having a trauma uh, literate lens as we deliver care from our own selves and to those communities and patients that we provide. It is so interesting to me that although people don't understand childhood trauma, and there's a lot of kind of mainstream discussions of it, ACEs is the one that has been evidence-based and research in tens of thousands of research papers, as well as by public health departments and organizations across the 50 states and territories. So it is not just talking about childhood trauma as a general, all comprehensive umbrella term, but it is tied to ACEs and how that impacts in adults, even leading causes of death. Something, as you can see here, Alzheimer's disease, stroke. So when we think about behavioral health in to care, we're thinking about actually talking to someone about how their lived experience is showing up, or as someone has said, as if you've anyone here, how does a body keep score? And it's not just keeping the score around psychosomatic components, which is where usually people think about the body keeps score, but actually, or different types of systems, either respiratory, or systems, or even cardiovascular keeps the score. As you can see here, heart disease to chronic lower respiratory diseases are higher rates for odds ratio for people with 4 or more ACEs. And this is also like the science behind it is very, once someone understands ACEs and so understands, it is better to inform how behavioral health and an ACEs screener can help people navigate what they are. So the adversity when a child is exposed is that they develop chronic or toxic stress, and then it activates their stress. And then that stress physiology then means that it goes into disrupting the cortisol rhythms, and then it accelerates the cellular aging, and then it drives multi-system dysregulation. This happens also generation also from mother to child in the womb as well. So women with higher ACEs are their children are more prone to certain disease, conditions as well, and that is something that I take very clear and try to partner with organizations that are able to provide this literacy for mothers who have had adverse childhood experience to understand how that's impacting even their unborn child, into not everything has to be transmitted, but definitely can be managed once people understand how that body has kept their score. And then we talk about allostatic load, and it's basically just the cumulative wear and tear of the body over time. Especially, you'll see here on the right, you'll see where chronic diseases happen to people with ACEs. So, for example, my husband has no ACEs, and he would be the type of person that in his 40s, he will be diagnosed with some chronic diseases, but he'll be the line at the bottom, the darker line. Someone like myself with 9 ACEs, by the time I hit 50, I will be almost at a at a risk of almost being diagnosed with a chronic disease. Thankfully, I've been able to heal and promote, and I've had the privilege to actually understand my own ACEs as it relates to my body. So that is something that I am no longer concerned about, but I think everybody that may not be there, and hence why Profunda Health exists, that should be available to everybody regardless of their privilege or their status of how ACEs. And then in chronic diseases, do risk of heart, metabolic, and autoimmune conditions, especially women, and as well as behavioral and mental health. And now that we know that there's so many much clearer links between ACEs and chronic disease, we're still thinking about early intervention and sustaining costly reactive care, of saying, okay, this person already has been diagnosed with substance use disorder, or this person has been diagnosed with PTSD. What do we do now? Instead of actually having people understand their health literacy from the time they're children to their young adults and adolescents, to actually into adulthood is like, how did this impact my systems? How is it manifesting over time? And how can we actually explain? And obviously, machine learning and AI are really interesting here. Our platform and is I will give everybody an app form is actually looking at this proprietary assessments through evidence-based tools to assess the ACEs related beliefs. It is trauma informed. So at any given point, people can opt out to not be there. But we also understand that it uncovers personal and gender specific care barriers. We also think beyond the cumulative ACEs is a multidimensional model that just saying yes or no to an ACE doesn't mean that it was not applicable. So we switched the ACEs from yes, no to applicable, not applicable, and to also look at the severity and duration and timing of those adverse experiences, which the standard ACEs tests don't do, which is just saying yes or no, this happened to you. So when I took the ACEs the first time, I was like, yes and no, this all happened to me. What do I do with it? When I know one or two of those ACEs are the ones that impacted my health the most. So for us, is really understanding the health outcomes for more of a multidimensional understanding. And we do think that it is important to be trauma informed and by design, that people feel that it empowers them rather than weights them down, and understanding that there's connections and social health associated with that as well. And we do health literacy in the platform. So saying, hey, research has shown that people have experienced this will at a risk of this, but this is not deterministic. And we make a point that your ACEs score is not deterministic. And we do that through health literacy. So it is important to understand childhood experiences, health, and impact, not through a deterministic lens, but more through a trauma informed social health design. Our clinical director, who has come up with what we're going to launch this week. So this is really excited. It's called the Connect Framework, which will build, anyone can do. You don't need to go to therapy. Anyone can do and will listen to it. And it's basically how people can understand ACEs or behavioral health. So any of the patients here can just say, okay, well, now that I know ACEs, what do I do? And it is basically the Connect framework goes through cognitive skill development, optimized stress management, neuroplasticity, the ability to understand how your mindset actually works, network or social health, so community, emotional intelligence, coping strategies, and then the big T, transformation and resilience building. So that will be an approach that we will, more of that will be coming out. It'll be an audio that anyone can listen to at any given point and just understand their Connect framework as it relates to their everyday health. And we have great experts as well that are all focused on health equity and also on behavioral health. So this is um, some of our advisory board. I made sure that I am not a doctor, so I wanted to make sure that I had a diverse and clinical board from people that have their own lived experience, but are also everything from pediatricians to actually psychiatrists to family medicine. And that is Profunda Health, which leaves me exactly 12 minutes. But before you go out, you can actually go through Profunda, the whole step of Profunda Health or any of your patients. And once they can take the ACEs, we'll be able to say, hey, like, do you want to take the ACEs? Yes or no. And if they don't want to take it, it's fine. But we believe that it allows people to understand more. And that's how you can actually take the behavioral health component from doing the screeners through a PDF um, in your clinic to actually doing online, so that they are able to do it at the time where they feel more comfortable. And if they use the checkout code Connected 2025, it will be totally free for everybody. So please feel free to use Connected 2025. They will have access to over 100 articles on ACEs. There are some that are translated, some that need finishing translate. They will have access to Connect, and it will also, you yourself or anyone that you know. And that will be the subscription model will come up after you finish the assessments. And I will stop sharing. Stop sharing here. Okay. Great. I have some questions here, and we'll definitely take that into account right now. Into the first, I have: does the screening tool integrate to EHR as discrete data in the screening tools questionnaires without duplicating the work? Yes, we have an ability to integrate into EHR. The only thing is that it depends on the clinics on how they want to integrate it into the EHR. People will feel, we know that, for example, here in California, a lot of our clinics um, do ACEs screening through ACEs Aware program covered by the state of California for Medi-Cal patients. They already have a tab in the EHR around ACEs. Yet those ACEs, as I said, is very much yes or no, and they don't show any of the other nuances that they would do, for example, in the clinic. That being said, we know that we also are working on modelings that are proxy through the EHR data. So not necessarily just looking at like, here's an assessment, tell us what you think, more of like, hey, we have all this data that may infer that these people is living with trauma. So we are also working on that. So we definitely do have the ability to integrate to EHR. There's certain clinics that have been participating in ACEs Aware, and communities-based organizations that have been participating in ACEs Aware in California. I know New York as a state as well is doing ACEs screening through Medicaid. So that is available. Um, Yes, I think how do we emphasize ACEs to be the clinical component of patient care while addressing their clinical needs that brought them to their appointments? It is so great. I actually was supposed to be at another conference today as well. It's called in Vegas, and I chose to rather just be centered here because one of the things that we're working on is to actually how do we how can AI help those clinicians like yourself, Anu, to say, okay, we know that this person is coming in here with unexplained abdominal pain, and this seems from all the EHR data, including from the past and um, what we know that they maybe need trauma informed care, and so we wanted to prompt people within the interface themselves to say, hey, focus on the pain that brought me here, but acknowledge that there may be that all of their life history can actually help us understand better how to care for them. So that's definitely a great question. We think it is important to understand ACEs, to not let it take away from the main point of this appointment, which is, hey, the clinical needs. I always joke around that nobody wants to go and take their blood pressure and then talk about their childhood in there and be like, oh, well, I don't know if this neglect happened to me or didn't. It's much more of like, we want to acknowledge that all of you showed up at this appointment, but let's get you the help you need now. And then yeah, is there data to see improvement in patient reports to their ACEs experience that help them to come out of their painful experience? There's a lot of data. I have decks for investors, for clinicians, for health systems. There's a lot of data about how the self perception actually is the first step of healing. And so towards the end of our platform, you will see different ways that we put in your self perception. Did this ACE affect you a little? Somewhat, a lot. And those self perceptions, and at the end, all ACEs screening, including the ones that are validated by public health departments in a court different states, also have, did this affect your health? And those self perceptions are actually very much more important in how, with the evidence of how people understand their health and their healing. So it definitely feels like that the data is there. I will send the data. One of our clinical advisors has done work with Epic as a trauma-informed registry, where they have shown that that's the number one indicator of people experience of understanding their ACEs is acknowledging through their own self-perception, not a clinician, not anyone else, but how they feel those ACEs have impacted their health in general, and each one impacted them. And then I think I see Ankita here asking, since ACE is more patient friendly, how will this impact PHQ flows? Yeah, I know for PHQ, we do have our clinical director and I were thinking about how do we understand all the screeners within PHQ workflows. And we do have to separate that one is a screener with a potential to diagnose, obviously, for depression, whereas ACEs is not a diagnostic tool. So those conversations tend to be a little bit much more of not complicated, but much more complex of how we can understand behavioral and mental health, not just from a one-dimensional, right? Like the risk for suicide, homicide is a risk itself, but we understand that ACEs may be a way to not elevate, but actually put light forward on that patient's experience. So we definitely agree that the different screeners should not all be shared the same. That's why when you go into our platform, you'll see a brief resilience screener, and a positive childhood experiences assessment as well, because those are much more indicative of us thinking on a whole person, whole life, rather than this more of a screener that is much more focused on time based, that may be like either PHQ and or depression. So our clinical director does a really great job of making sure that we take a step back to understand mental health diagnosis versus integrating behavioral health, wellness, and ACEs into the lived experience. And then, no, it's not HRSA approved yet. We're still in the early stages of building this out. We really just wanted to focus on the health literacy, on understanding ACEs. We're getting to clinical flows. We've done it with some clinics here to how their clinical flows are, most of them EHR. So I think that's about it. Any other questions? Okay, well, I definitely want to thank you, Cecilia. I want to thank everybody for coming here. Behavioral health, in the case of Profunda, we're taking ACEs. We took the ACEs because it is a tool and an assessment that has shined light in so much of how people perceive their health. From my own lived experience as well, like when I took ACEs away from just a therapy focused, talk therapy focused mentality and mental health, and took it into my own health, it changed my own healing. And so I definitely feel that this came from my lived experience, but I know that for my founder and my technologist, as well as my public health background, I needed to have this and build something like this for it to be integrated into a way that we can actually have the impact, and how we can actually build systems for everybody, from someone that has no access to even understanding mental or behavioral health, to just acknowledging the patient as a whole rather than just their symptoms that made them seek care. So I'm hoping that our platform in this version, along with the health literacy, with all the resources, the assessments that we have there, please feel free to share with anyone connected. 2025 will be the code that they can put at the end, and they'll have access to even webinars and our Connect framework by Dr. Morkeb Leitofi coming out this week.